So guys, people who are joining me, if you guys have followed me, you would have known that I was under Dr. Geetika for a very long time, like almost 2 years. And when I had met her first, I had acne. I had like little, pitted scars. So first, she wanted me to treat the acne. We did a couple of medication, which we'll not be able to talk here, but the treatment that she gave me was a carbon facial. Is that what it's
Yes.
called, right? Carbon
Yeah.
facial. I did that along with there was another one which was I think a
Glow infusion. Yeah.
glow infusion. It really helped me to shrink my pores. My acne was taken care of, and I absolutely loved the whole treatment. And today we're gonna again, I have flared up here and some of the places here, so we're going to talk about more about acne and open pores and pigmentation.
So what we actually wanted to do for you was not only, whenever generally we see a patient with acne is not something that you can straight away jump into getting treatments and treating it. It's very important to understand what is causing acne, and thereby we not only treat with the help of clinical medicines or local applications, but we also need support of some treatments like lasers and peels. And carbon laser has been my favorite because it not only combines carbon, which is very well known for its detoxifying and adherent properties. It just, clicks onto the toxins in the skin and removes all the toxicity and those clogging sebum and dirt from your pores. But together with the laser, because the Q-switch laser, it helps shrink your pores, it helps reduce the sebum secretion, it also helps reduce the active acne. So anyone who's seeking something to just, improve their skin tone or shrink their pore size, or they have an oily skin, carbon laser is a wonderful treatment to go for. And you're right, some patients see instant results with this treatment, and for some patients, they take about 2 to 3 days for the skin to start rejuvenating and actually showing good results. So it is really important to plan the treatment with the help of your doctor that what exactly your skin needs. And the second treatment that we were talking about was glow infusion. I generally use this treatment a lot for my patients during the winter months because
Yes.
glow infusion, you can pick and choose the cocktails that you can actually infuse in your skin. It can be hyaluronic acid, it can be vitamin C, it can be a bespoke cocktail that is made for your skin. So we do that generally in combination with other treatments to just help your skin build up from inside.
And what exactly can one do for, like when you take, for hydration, like in a place like Mumbai? I mean, I think I just got acne in just 2 days, and also my skin felt some was feeling greasy, then sometimes was feeling like dehydrated. So what can one do, in a temperature like in Mumbai?
So it's really important with the changing weather, like how to change your wardrobe. You also need to look at your skin like that. Your skin is the largest organ of the body. So any changes on the skin is actually telling you what is going on inside the body. If your skin is suddenly feeling very sensitive and dry, you need to understand that has your diet changed or has your hormones got imbalanced? What is the real reason? And when we talk about dehydrated skin or dry skin, it not only means applying loads of moisturizers on the face, but also increasing the water intake. Because your dehydrated skin be just a dehydration from inside. So you need to increase the water intake, and especially during winter months, this air outside is also generally very dry, which sucks out all the moisture from the skin. So you have to increase the water intake, not orally, but also generally speaking. And then for the face, you have to look at your skincare regime, like moving on from the foaming face washes to creamy face wash, and not using hot water to wash your face. Use, just warm water and make it really quick. Because more and more water you put on your face, more and more dehydration can appear. So use a creamy face wash followed by a toner, non-alcohol based, because alcohol based toners will generally lead to more dehydration and drying of the face. And then third would be the essence or the serum, and try to layer all the products very quickly, because more and more you layer the products, more and more moisture would be locked into your skin naturally. And after the serum comes a moisturizer. So people, everyone who even have oily skin need a moisturizer. It can be a gel-based moisturizer, but you definitely need a moisturizer. Like in Delhi, there's a lot of people who are having acne due to pollution. So there are a lot of moisturizers and sunblocks now available with anti-pollution properties, which form a layer on the skin and they don't let the pollution go inside the pores. And with mask usage, people are getting more and more acne around their face, which is called mask acne. So it's really important not to wear makeup under the mask, to wear very light molecules with moisturizer and serums to let your skin breathe under the mask. So follow all these things, and I'm sure it really helps. But on a day which is gloomy and there is no sun, make sure you still wear a sunblock, because there are invisible
Yes.
UVA, UVB light rays which can also give photo aging to your skin. So make sure you follow all these things to the T.
Like post our conversation, I'm going to take the carbon facial, doc. I just wanted to know that like, when can I start using retinol? Like, is it okay to use retinol when you're doing some treatments on your skin, or?
Absolutely. Retinol is one of the very good products for skincare. In fact, I suggest it to everyone who is in their late 20s to start using retinol. But there are few do's and don'ts when you have to use retinol. You should start very low dosage, like a percentage retinol that you're using should be retinol 0.5%, and then use a very small amount. I know it gets really exciting to use a new product and you start using it, a lot of amount thinking it will do wonders. But using a lot of retinol can cause a lot of harm. So use a small amount of retinol. You can even mix it with the moisturizer to make it more easier for your skin to absorb, and use it maybe at alternate night. So 0.5% retinol mixed with the moisturizer, alternate night is the right way to do it. And next morning, make sure that you put sunblock, because retinol does make your skin more sensitive to the sun. And retinols are great for anyone and everyone who's joining in and doesn't know about retinol. It's a wonder molecule, not only shrinks your pores, but also lifts your skin, and it also helps remodel the collagen. So if you ask me which are the wonder products in skincare, retinol is definitely one of them.
Wow. I'm gonna just make it a part of my routine. And is it like once a week that one should apply, or you can do alternate
So you
days?
can start alternate nights, and once your skin gets used to it, you can start using it every day.
Okay. And doctor, a lot of people are asking about supplements, like how important it is to take supplements for skin. Like what are they? If you could just highlight that.
Absolutely, because with COVID, thankfully, people are giving a lot of importance to supplements these days. Be it the vitamin C, which has to be at least 1,000 international units every day. Vitamin D, about 60,000 international units once in a week. These are some of the basic supplements that I'm seeing everyone taking to enhance their immunity. But for your skin, vitamin C definitely helps. You can add on glutathione, which is a natural antioxidant and helps in your skin rejuvenation, and it also helps in improving the tone and your general brightness of the skin. Going ahead, there are collagen supplements available in the market, which not only helps improving your skin, your hair, but also your bones, your nails, all of it. So you can always take the help of your doctor and understand what is the dosage required for you and how to take them and what is the combination that would work for you.
Okay. So now, just we'll make this conversation very short, and I want to come back to me now, and I want to ask you, now that doctor, you know that I have acne-prone skin. Now, I do get acne on and off, and I do have these marks. So if somebody like me is coming to ISAAC, what, like, sometimes you're clueless because there's so many treatments out there. What can one begin with?
So to understand that, first of all, because you're coming to ISAAC, we would look at your skin, understand what is the reason of your acne, why is it happening? And probably if you have acne more around the lower part of the face, it is generally hormonal acne. Otherwise, when it is on the upper part of the face, like the forehead and stuff, it can be related to your gut or stress or higher intake of sugar. So we have to understand what is the reason, and definitely we'll talk offline about the medication that you have been taking so that I can revise it. And a treatment like carbon laser will just help reduce the sebum secretion. It will
Okay.
also help in deactivating the active acne. It will also help in reducing the pigmented scars which are left by acne. So
Wow.
treatment like carbon laser helps in that. But acne is a clinical condition which has to be solved clinically. Some tips that one should always follow: if you're wearing a mask every day, which I'm sure you are, make sure just wash it after every use. Don't keep applying the same mask every day, consequently, because that is going to cause more infection and dirt on your face that will cause a reaction. Don't wear makeup under the mask because you need your skin to breathe. And make sure you also clean your phone screens regularly. You change your pillow covers regularly. Just
That's so
following these
important.
small things can really help, yeah. And limiting the sugar and dairy intake. With lockdown, everyone's actually becoming really good at cooking and trying new recipes, but that's not really good if it involves bakery and a lot of dairy. Just try and avoid all of that.
So you're saying avoid. I was just coming to that. Is the kind of food that we should avoid. So bake. So dairy is a complete no for me because I just break out. Is there anything else that one should avoid?
So dairy and sugar. Sugar is another thing that you should stay away. Sugar can cause not only acne, but it can also cause insulin sensitivity. And a lot of young girls come to me with dark, the back of their necks are dark, the folds of their skin under the breast, under the tummy is dark, forehead pigmentation is there. This is all suggesting insulin sensitivity. So you have to stay away from sugar. Sugar is actually the white skeleton of aging. The more and more you avoid sugar in your diet, it is better. Use natural sugar substitutes like dates or gur, which is very high in iron and fat. So try and substitute those things rather than white sugar, which is actually really bad for your skin.
And Dr. Now, I believe, if I'm not wrong, you've also started your own skincare at ISAAC, and I'm super
Absolutely.
excited
It is
for
so,
that because I was just
so
going through your page and I saw and I was like, how did I miss that? And if you want to
super
say something about
excited. Thank you. We are super excited. We are still to, put it online for everyone to buy it. The idea is to help everyone sitting out there in any part of the country have an access to good skincare, which is effective and yet it is very much affordable. We are launching an interactive platform wherein you can do
wow.
your own skin diagnosis to understand that what product actually suits your skin before you just randomly buy something because it was suggested or it was marketed like that. So we are doing a lot of research. I've put a lot of R&D and my own experience into it, and I'm sure this would be available online very soon, probably first week of December it should be there.
And yeah, you also suggested me lymphatic treatment. What
Oh,
exactly
yes.
is?
We are doing the balancer for you too. And that's in fact one of my favorite treatments during the lockdown because we are unable to go for our regular massages and go to spas for relaxation. So balancer is a wonderful treatment, which is a no-touch massage. What it does, it works with the help of pressotherapy. It inflates and deflates by increasing the lymphatic circulation of the body. So one would feel not only instant relaxation, but you can also see instant inch loss because all that extra lymph which is accumulated in the body is triggered to just release on its own. So
Wow,
it's a
so I'm going to do
brilliant
that. I hope I lose an inch.
Absolutely. It's a brilliant treatment for instant detoxification,
Wow.
for feeling lighter, for any muscle soreness. It's something that one can actually go for like once or twice in a week without any hesitation. So I'm sure when after your treatment, you will feel much lighter and happier and glowing.
That's amazing, doctor. Thank you so much. Actually love your clinic. People who are watching, you should know that it's absolutely safe and hygienic, and everything is so perfect here. And I have only seen one patient coming. It's all by appointment, so it's absolutely safe here. So anything else, doc, or we are good to go with my treatment now? And we end
Very
this.
good. I can't wait to hear how you felt after the treatment. So, wishing you all the best. And we are
Thank you
trying
so
to
much, doctor.
maintain the best safety precautions at all our clinics. So, I'm sure you will enjoy
I
it.
hope to see you in Bombay soon. Hope everything then settles down and is
Absolutely.
back to normal. I'm going
Looking
to see you
forward to
soon in
it.
Bombay. Take care,
Thank you.
doc, and thank you so much.
You too. Thank you. Bye bye.